Hi, my name is Eric Kazanjian, and I'm a fourth year medical student at the Quinnipiac University Frank Netter School of Medicine. In this video series, I'll be interviewing individuals who have been diagnosed with Alzheimer's, as well as their caregivers on what it's like to live with this disease and how their lives have changed because of it. The purpose of these videos is to give these individuals a platform to make their voices heard, to educate the public, and to reduce stigma surrounding Alzheimer's. I've also interviewed two healthcare professionals to get their unique perspectives on the challenges of caring for those living with this disease. And lastly, I've included some resources on the channel, which I hope may be helpful if you, a family member, or a friend has been diagnosed with Alzheimer's. Thanks for watching, and I hope you enjoy.
You've had a lot of experience, it sounds like, in caring for patients in general, specifically with dementia, some other neurological diseases. But what are some of the challenges that you've noticed when it comes to taking care of specifically patients with dementia from a provider standpoint?
The hardest part of it as a nurse is to have the time to sit down and to get to know the patients and their triggers and their habits, the things that help them to be who they are, and the things that they did at home to find out their history, to know why they do things. I like getting to know them, and that made a big difference, because then you knew why they started yelling in the middle of dinner and saying that they were freezing to death. One of the gentlemen was from the frozen reservoir is where he served, and he almost froze to death. And when the air conditioner came on, he thought he was freezing to death. So you had to make sure you kept him away from the air conditioner. Just different things about each one of them.
Mm-hmm. So it sounds like really like being able to spend enough time to understand, a patient's history to be able to provide better care for them.
Yes.
Going forward.
Yes.
Okay. Now turning the attention more specifically to Alzheimer's disease, are there any specific resources that you would recommend to someone or encourage to seek out who's been newly diagnosed with Alzheimer's?
I know the hand in hand. I have a couple of other things that I have on my phone. I don't have them memorized, but just a second. My notes. There was the Alive Inside, and then I did like the validation therapy that we had come in and do in services with our staff. And then I like the hand in hand video series that they can find on YouTube. That's also through CMS that helps teach about Alzheimer's and also dementia. And we also use our psych group to help us with the behaviors of it, so they can help us to understand the different behaviors.
Great. So just to repeat some of those again, there was the hand in hand I heard
Yes.
about. Okay. And what was hand in hand specifically?
It is hand in hand. It's a teaching from the very beginning. There's a video series. There's also like a book that's like this thick that they can go through, but it just teaches them how to relate to people with Alzheimer's. It tells their stories. There's videos that they can watch a patient in their environment and what the issues could be. It helps explain to them the visual issues that they might have with the different Alzheimer's dementia. It just kind of helps them put them in their place, in somebody else's shoes.
That's great. I'm trying to put together a list of resources that I'll include in my YouTube channel as well. So I'll try to drop that in there.
I like it. It's on YouTube, so it's easy for them to even do, even on the floors. It's like 5-minute videos, 10-minute videos. It's kind of nice.
Yeah, that's great. Anything that's educational that helps people, I think, is really valuable. One of the recurring themes I've come to over and over again when I've been interviewing, these individuals who are living with Alzheimer's disease now is that once they get this diagnosis, a lot of times they get the diagnosis and then they're not told, what to do, or they're not given really any resources to follow up on. And it's very, frightening and confusing.
Yes.
You having had so much experience working with these patients, what would you tell them to do? Or where's the first place you would tell them to go if they've just been, a friend or family member of yours has just been diagnosed with Alzheimer's?
To sit down and write a list out for the family of your likes, of your dislikes, to kind of get things in order to help them understand who you are. It's hard to take care of somebody if you don't know. They don't like to take a bath. They like to take a shower. If they like to brush their teeth in the morning before breakfast or after coffee, or different things, it kind of helps to know that if in the beginning, because later on they're going to forget, and you may not know why they're stomping their foot or pushing you away if you didn't know they didn't like that.
That's really helpful. So I think just to go over that again, you recommend, like really having that person or individual sit down and write out a list of, their preferences, and then also to spend time with them as a provider in getting to know them more. That seems to be something that you've mentioned a couple times now.
Yeah, and it's nice to know, do you put your glasses on the left side, the nightstand on the left side of the bed? What side of the bed do you get out of? It's things that we were taught. We did person-centered care in Kansas. We were taught to ask those questions because it helps them be less of a fall risk. It helps them start their day the same routine they had for 20 years. Especially if you go into a nursing facility and they don't know they don't know your life. It's good for them to know the routines beforehand.
That's really great. I think you've definitely alluded to this next question in your previous statements, but can you talk a little bit more about, to you, what compassionate care looks like when it comes to taking care of patients, just generally with dementia and more specifically with Alzheimer's?
Sometimes when people are busy as providers, it's sit down, be careful, don't move, and you kind of set them in front of a table, and you don't know that whether they like to do puzzles or color or whatever, but you set whatever you like down in front of them. So to me, compassionate care is finding out what they did. Like we had a gentleman that was a maintenance person. We'd find him on the floor every day under the bed. He was trying to fix the bed. He wanted to mess with bolts and nuts and things. So you had to give him a busy board that had locks, bolts, nuts, things that he was used to. Finding out whether they were like a parent that wanted to carry babies around, or if they we had a gentleman that he loved babysitting the babies. He'd steal the babies from the women because he wanted the babies. So we had his family get him babies. I had a gentleman that rode the back of the couch because he loved horses. We talked to the family about trying to find somebody that bring horses to him or take him to horses because he was in the cavalry. It's just trying to find out what they like and what they don't like and help and give that to them. Telling them that you like their eyes. You have beautiful eyes. I love your smile. We had a gentleman that he would sit up straight and be real proud. He'd take off his hat because it was a veteran's hat. And we'd tell him, we love your hat. He'd just be so proud. You could see the fireman veteran. He was a police officer and his at one point. You could see that it came out, but before that, you just see him sitting there, sad.
What are some of the challenges that you've seen, through your firsthand experience that patients and or families go through when they've received a diagnosis of, any sort of dementia and more specifically Alzheimer's?
Sometimes it's just not having any knowledge of it and not knowing what to expect and not knowing what's to come. And it's really scary to watch somebody change in front of you, and families are already losing their family member right in front of them, so the grieving process starts very early on. And then at the same time, they don't know how to help them, and they don't have the resources out there or don't realize they have the resources. I know there's Alzheimer's.org and several different others, all the time stages in their brains that they could be going through that you don't know where they're at. That's the hardest part, I think. You don't know whether they're in their childhood or whether they're in their adulthood or where they are during the day or different times of the day. It makes it hard for the families, I think.
What are some, kind of like easy facts that you could give to, the general public that they should know about Alzheimer's disease, or individuals who have been diagnosed? What are some, sort of easy or key takeaway facts that you could offer to the public?
When you have a family member that has been diagnosed, remember not to argue with them. Remember that they may be saying the word fork, and actually in their head they think that they're telling you TV. They may be lost in a different time. Just try to live in their world, try to keep them as comfortable as possible, spend as much time with them as they can, especially early on, and learn, like I said, learn about them, learn who they are. We have an era out there right now of people that are disappearing, and they have gone through the Great Depression. They've gone through the beginnings of cars. They've gone through so many different wars and time periods that it's amazing all the information that you can learn and the stories that you can hear. Write those stories down for your kids or for the future. I think learning about them is the most important thing. Enjoy them while they're still there, though. It makes me sad. Some of the people that I've, seen go through Alzheimer's and what, it did to them and their families. But there are so many moments that it just makes me smile, and so glad that I got to spend that time with them.